My name is Juan Guarderas. I'm an allergy immunologist, but I do work in the Department of Otolaryngology in the section of rhinology. So we concentrate primarily in nasal sinus disease. One of the strengths of the Mayo Clinic model of care is that we are not working in different specialties or in different silos. And in this concept of the rhinology clinic is we're putting together two specialties that most of the time they work separately in the community. So the concepts of both are interacted in trying to help the patient. So there's a lot of patients that come for allergy, nasal sinus congestion, what they call sinus headaches. And the other group of patients that come because they have required prior surgeries, prior medical therapy, and for some reason they're not responding. About 25% of the population has some degree of allergic disease. It could be mild, moderate to severe. On the other hand, you have this misconception that every time that I have a pain or pressure in my face is related to a sinus infection or an allergic response. And this probably is not the case in the great majority of the patients. But I think it's important to exclude that because otherwise the patient starts using excessive amount of medicines, most of these available over the counter. Most of these have some degree of side effects. And on the other hand, there's good evidence that the quality of life of the patients who have nasal sinus disease and headaches is really impacted. So a good definition of disease, a good diagnosis, helps you in first have the ideas clear, and secondly provide adequate therapy and avoid excessive treatment. The other big misconception that I think is worth paying attention is that allergies that everybody has allergies, especially allergy to dust mite, and there's nothing you can do about that. One of the beautiful things about treating this disease is that we can do a lot to improve the symptoms and the limitations that these diseases produce.